A dialogue with youth-led organizations, women communities affected by COVID-19, as well as public institutions has taken place to present strategies that will reduce the burden and impact of the pandemic and future on people and communities. Participants at the event believe that recommended strategies should spur government and institutions on strengthening response for present and future health emergencies. Health correspondent Kemi Balogun reports.
The world adapts to the realities of the aftermath of the pandemic. Many people have stories to tell about how COVID-19 affected them individually and collectively as humans and as communities. The push in this room is to listen to these experiences and provide solutions for those affected ahead of future pandemics. This is being driven through an 18-month project in 3 West African countries: Nigeria, Ghana, and Senegal.
We need more voices to talk about the fact that we know that humans are resilient. We know that we faced a period where COVID-19 puts a lot of people into challenges. But the reality is that as members of society, government must provide an adequate framework to support the people. And that means that we have a social protection policy.
It is now time to move on from the effects of the pandemic and find ways of strengthening response for future health emergencies. The discussions here revolve around the theme Post-COVID-19 Environment, Stories of Community Resilience and Solidarity. Issues dissected include impact of the pandemic and ways to ameliorate the burden during times of a health crisis.
Find out that the problems and challenges across these countries are similar and the same. For example, in Ghana, government announced distribution of palliative, but from our findings, these citizens were unable to access this palliative. Same for Nigeria, same for Senegal. So you find out that as such, these individuals had to look for other means to survive during the pandemic.
So we were able to do 3 things. Essentially, give out relief. 2, educate people on the pandemic, and also conscientize them to also have the spirit of sharing.
West Africa is said to be underprepared due to the current healthcare system realities, with many believing they remain incapable of effectively addressing the holistic impact of future pandemics. Kemi Balogun, TVC News, Abuja.